Amanda, thank you for the time. How you doing today?
I'm doing all right, Trey. How are you?
I'm doing very well, thank you. So, what was your goal with splitting?
Well, my goal with splitting was to talk to people about something that's incredibly fascinating, which is headache. And actually, beyond that, there's something that's even more fascinating, which is what's happening inside of your head, what's happening inside of your brain, what's happening with your behavior, what's happening with your biology. How do all those things interlink with each other, and how are they all wrapped up in your environment? And headache's a really good microcosm by which to explain that. And one of the goals that I had was to just, if you'll forgive the expression, to knock it on the head that all headaches are migraine, because everybody thinks they've got a really bad headache and so it's migraine. It's a little bit like we used to say pre-COVID, if you had a cold, it wasn't a cold, it was the flu, but not all colds are the flu, whereas not all headaches are migraines. So it's about teasing those apart and saying it's really important to understand what kind of headache you're experiencing so that you can treat it properly.
We will certainly get into the specific types of headaches, but mechanically speaking, is there a common quality with most, if not all, headaches?
Certainly is. The main thing that causes pain in headaches is a widening of the blood vessels in the head. And that sets off danger signals because we really don't want widening of blood vessels in the head beyond the comfortable limits of those blood vessels, because we keep blood separate to the brain. We keep it separate via the blood-brain barrier. And that's really, really important because blood is very toxic to brain tissue. So if it meets brain tissue, it kills that brain tissue on contact. That's what we all recognize as stroke or a hemorrhage in the brain. It's one of the forms of stroke. So we have a very early warning system for that. And that is known as pain in your head. So you get the widening of blood vessels, sets off these little receptors that live in the blood vessels, and those signals are sent off to the brain, and we interpret it as pain. And basically that pain is there for a reason. It's there to tell us to stop what you're doing. It's dangerous. If you pull a muscle in your leg, then you're not going to go out and play football, are you? Because you might cause your leg more damage. And it's exactly the same with pain anywhere else in your body. Your head is no different. It's to protect your brain. Your brain is the most important organ of your body. So our early warning system is very early. It's very, very early. So I'm not saying that any headache that you get is a sign of an impending hemorrhage or stroke. It's just that the warning system is very, very early, just to tell you, you know what? I'm not quite happy. There's something going on in here. Just take it easy, okay? Let me just reset everything. And that's what that pain is telling us.
This book is not only informationally dense, but it's also very witty as well. Kudos on the sense of humor that you infuse throughout these pages. And speaking of, laughing a lot can cause your head to hurt, as can thinking too much, thinking so much that your head hurts. What's going on here when your head hurts as a result of something that you are intentionally trying to do?
Yeah, well, part of it has to do with the fact that if you're concentrating for a very long period of time, you get extra blood flow to the thinking parts of your brain, particularly in the front of your brain, your frontal lobe and areas like that. And of course, if you get a sustained amount of blood flow coming to an area of the brain, then those blood vessels are widening. So again, we're back to that whole early warning system. But you also have other things when you're concentrating for a long period of time. You get eye strain, for example, you get postural changes. Lots of us just sit in front of our computers all day on Zooms and we're just writing documents around it. Oh, it goes on and on and on. And we're all sitting in the same position. Sometimes we're cold, sometimes we're too hot. Our body just isn't comfortable. And that all is like stress response, really. It's a physical stress response, but our brain can't actually tell the difference between a physical stress response and emotional stress response. So we actually feel emotionally stressed when our body is stressed. So if you're sitting in the same position all day and you're just working or whatever it is you're doing, then you're getting a lot of a physical stress response. But actually then you begin to feel tense, you feel a bit tetchy, you feel a little bit like, oh, I hate my job, what am I doing here? It's all very emotionally intense, and that's because your brain is mixing up those signals. It's interpreting your physical stress as being an emotional stress because it's exactly the same as far as your brain is concerned. So we react in exactly the same way. So you get again, you get rebound, vasodilation, all sorts of things that your body tries to do. You get inflammation, you get a big immune response, all the things that your body tries to do to fix itself. And actually, sometimes that can make things worse. So it turns into a big vicious circle, really. But laughing should help.
Oh, go ahead.
Laughing should help. The reason why laughing would help is because you get a little shot of serotonin, which is a really, really important hormone, neurotransmitter in your brain, helps you pass signals from one neuron to the next. And it's a very powerful painkiller. And it's very important in mood regulation. So when you're happy, when you laugh at something, and when you've had a really long day, you decide to put on a comedy, you decide to put some cat videos on YouTube where cats are falling off buildings, and it's all very hilarious, just until you see the splattered cat. Really, that's not hilarious. But you might have a little chuckle, and that then you get a nice squirt of serotonin, and that's a natural painkiller. So it blocks the pain signal from your body getting to your brain.
Many of us love those random YouTube videos, and many of us have also experienced that delicious bite of ice cream that has turned into brain freeze. What did McMaster University associate professor learn when studying brain freeze? That is obviously a common affliction of consuming things like ice cream or Slurpees or ices too fast.
Yeah, now Slurpees are my downfall, I have to say. And the reason why is because when it's even worse when you direct the cold stimulus right up onto your palate. And that's the key. It's actually a referred pain from your palate, the roof of your mouth. It has nothing to do with your dental sensitivity, which is what it used to be thought of as being the root cause of this. But actually, it's from your palate. Now, it's referred pain. You don't feel it in the roof of your mouth. You feel it in your temple. It's really funny to induce this in children because they've no idea where this is coming from. It's hilarious. So you just get children with their hands smacked up to their temples and their foreheads. And it's referred because all of the nerve cells that cover the roof of your mouth and your buccal cavity in general, which is your mouth. So shut your buccal cavity. It's the best curse phrase there is. It's all lumped together with all the other input coming from the rest of your face. And your brain can't tell the difference between the input coming from your forehead and coming from your mouth. So it actually feels it from your forehead. It's pretty much the same as when your heart is working without oxygen and it produces pain signals. You don't feel a heart attack as a pain in your heart. You actually feel it as a pain in your left arm. And that's because all those nerve cells are all bunched together and your brain doesn't distinguish between what's happening in your chest area and your arm area. So you feel it there. It's called referred pain. So you get that. And the other thing that happens is that your brain doesn't like to be cold. It really does not like to be cold. It has an optimal working temperature. And I always say this, my brain doesn't work well in the cold and neither does my iPhone. So does that make my brain an iPhone? There's a little bit of syllogistic logic there for you. No, but here's the thing, you're not dead until you're warm, sober, and dead, because alcohol and cold have pretty much similar effects on your brain. It really slows everything down. And exactly the same thing happens if your brain is cold. Now, because of that, you have an early warning system, because your brain is the most important organ of your body. And so you get a big rush of blood to the area to bring this nice warm blood to your brain to warm it up. And of course, here we go again. You've got your widening blood vessels, your vasodilation. Your brain goes, oh no, hold on, pain. This is bad. We don't want a widening of blood vessels. I need to tell you that this is happening. And so you get this throbbing happening in your forehead as well. So it's a double whammy, really. It has to do with the activation of pain receptors in your mouth, in your palate particularly, but it also has to do with this rush of blood to warm up your brain, because your brain thinks that it's all of a sudden gone very, very cold.
Allergy issues are a huge problem here in Austin, Texas, where I live. Is this a matter of sinuses filling up with mucus, creating this pressure that feels like that vice grip that many of us go through when we're suffering through allergies? That
Yeah.
pressure is what's causing the headache, or is there
Yeah,
something else at play here?
it, it's awful, isn't it? It's really hard to get over as well, isn't it? And it really does feel like you've been hit in the face with a spade. And so sometimes it's very transient and it goes away very quickly, but sometimes it lingers, and it has to do with your own peculiar response to the allergen. So what happens? Well, what happens is you have a lovely, I mean, it's a wonderful system. It's absolutely gorgeous, but not really when you get in there. You've got this layer of skin. It's called epithelium, and it produces these this mucus, and it's like a travelator, you know. It takes all like dust particles and everything, and it just makes sure that it keeps everything clear. Okay, your sinuses are air-filled cavities in your face, right? Your bones, they live in your bones. And why do they live in your bones? Well, your bones are like corrugated cardboard. They're very, very strong, but they need to be quite light, really, because your head's very heavy. You know, your brain is nearly 2 kgs worth right there. You know, your head's really heavy. We can't be lugging around really, really heavy facial bones. So actually, they're kept quite light because you have these air-filled cavities inside, and you've got 4 of them. So that's 4 things that actually can get blocked up. Now, if you're really unlucky, they can all get blocked up, but actually, generally, it's just 1 or other, or maybe 2 out of the 4 might get blocked up. But they'll affect you differently depending on which gets blocked up. So if you typically get pain across your cheekbones, then that's one of them. If you get pain in your forehead, that's one of them. Pain between your eyes, that's another one. Just a generalized headache, that's another one. That's the deepest one there. And mostly it doesn't really matter, because decongestants will work for that as a worst case scenario. Menthol works as well. So menthol might be something like that you inhale. So it's like you put into water and you inhale it, and it opens up. You think it's opening up your sinuses, and it's dissolving all the mucus plugs and everything that's there, because they're all plugged up, because that's what happens in response to an allergen. You get more mucus to try to get rid of it, and then you get an overreaction, and that's what turns into an allergy. And with an allergy, then you get the inflammatory cells, the things that bring all the immune responses. They actually move so that they're stuck nicely on that epithelial layer. Oh, and they're not where they're supposed to be, but that makes you extra sensitive, which is why you have an allergy and your next door neighbor doesn't, for example. So it's a real mess, but it's there to protect you. It just becomes counterproductive. But anyway, back to menthol. So you can also have a menthol stick that you stick up your nose and you give it a good, you know.
Mm-hmm.
But the funny thing about menthol is menthol should never be confused with your lip balm, which comes in a very, very similar packaging. But if you shove your lip balm up your nose, which I have done on the bus on occasion, you don't get any menthol-like effect, because it's not menthol, it's lip balm, and people just look at you funny. But when you stick a menthol stick up your nose, you do feel like the whole thing is released, and that, you know, you can breathe again, and not being able to breathe is very stressful. So, you know, when you're not able to breathe, you get a big stress response as well. But actually what menthol is doing is it's turning on the cool receptors in your nasal area. And your brain goes, oh, hang on a minute, I haven't got as much inflammation going on there anymore. Oh, okay, then I'll take all that immune response away, because I don't need it anymore. And just by taking its foot off that pedal of inflammation, just a tiny, tiny bit, it makes a little bit more room in your sinuses. Your blood vessels constrict a little bit, and you feel like you can breathe again. And then that feeds back to your brain. So, oh, everything's great. I can breathe again. Everything's fine. It's an illusion. Menthol is setting up an illusion in your brain that everything's fine, and it's not. Menthol actually isn't doing anything to your airflow, really. It's just fooling your brain into thinking that it has. But even though you know that, it still works.
That's interesting. Is that same mechanism at play when you're stopped up and you eat something really spicy and you feel like you can breathe
Mhm.
again for a few minutes afterwards?
Yeah, there's a little bit of that, but actually there's a slightly more direct effect in that things like capsaicin and all those hot foods can actually give you a runny nose. So you get that sense of like, instead of being bunged up, and allergies can do both, right? They can make you bunged up or they can give you a runny nose. It just depends on what your brainstem thinks about the whole thing, really. But yes, what that will do is it will give you a runny nose. So if you are bunged up and you get a runny nose, you instantly feel like things are being released. And then that feeds back to your brain, and your brain gets a little bit less stressed about the whole thing, and the inflammation decreases, and it's brilliant. And what's fantastic about spicy food is that you do get a hit of dopamine from that, which is your reward hormone, your reward chemical. So actually, you get a little bit happy after that, really, as well. So it gives you an extra pep in your step.
That's right. At the root of what we've just been discussing is mucus or snot. Snot is an
Mm-hmm.
incredible word. Not only is it a
Love it.
mild cuss when we're little kids, but it's just a fun word to say as adults. You actually looked
Yeah.
into the history of the word snot. Where did that word come from? And what is your Snot 22 questionnaire?
Well, the Snot 22 questionnaire is the sinonasal outcomes test, and it came out of Missouri, and it was developed by Jay Piccirillo. It's got 22 questions on it, and it is a questionnaire that's designed to diagnose you as whether or not you are experiencing a sinus headache or sinus episode or not. So it's got lots and lots of questions on it about how it is you're physically feeling, but also how that makes you feel phenomenologically or emotionally, and also how it is that it affects your life. And so if you score high enough on that, that's a good diagnosis that actually you are experiencing a sinus episode, because oftentimes sinus becomes a little bit conflated with migraine, for example, and other kinds of headaches. And so really, it's really important that we diagnose headaches in the correct way as the correct headache, because the treatment will be different. So you would never think of necessarily treating a real migraine headache with decongestants, but that really works for sinus headaches. So that's why diagnosis is so important. Snot is a great word. You are absolutely right. And yes, I was banned from using it as a kid as well. It's and you know, it's really funny because certainly the way I was brought up, you weren't allowed to use the proper terms for anything. And it was always thought that snot was like this kind of colloquial term, but it actually is the proper term. It comes from Middle England. It's been around since the late 14th century, and it is just nasal discharge or mucus. And it led on to lots and lots of other words like German and Dutch variants like snutten, snotty, and snoot. And they all come from the base word snout. You know, it's a funny thing, really, because I thought to myself, you know what, we all use this word snot. Where did that come from? You know, it's like we all called the toilet the crapper, but we know that actually that came from Thomas Crapper, who made one of the first flushable toilets. So, you know, words come from places. And I was just really interested to find out where that came from. And it turns out it has a perfectly reasonable start in life. And I think we should use it more often.
Yeah, a lot of people might be surprised by the idea, by the notion that the word crapper may have come before the word crap, because there was a guy named Crapper.
Yeah,
It's
there
hilarious.
was a guy named Crapper, Thomas Crapper. Yeah.
Glad you
So
pointed that one
shout
out.
out to all you Thomases out there.
So, in your research, not just for this book, but for what you do for a living, you actually asked 7-year-olds about their experiences with headaches. What were your takeaways from that conversation?
Yeah, so my takeaway from that conversation, the main thing that actually really struck me was that even at 7 years old, 7-year-olds can think about their experience of headache and think about external factors that may have affected them and how it is that they're feeling. That seems remarkable to me. I don't think I was able to do that as a 7-year-old, that they can say, oh, well, you know, if things are really shouty around me, or if there's a lot of noise, sometimes I get a headache. And I'm not sure at 7 I would have thought about external stimuli causing something physical inside my body. But then I probably wasn't a scientist then. I didn't think about these things. I wasn't a desperately curious child, which is quite remarkable because now I think I'm making up for it.
That is great. So stress obviously causes headaches. Many of us have dealt
Mhm.
with a headache that is as a result of stress. Do you have some maybe common tips that could help a person out to become more resilient in the face of stress to avoid more of those anxiety inducing headaches?
Mm. Yeah, I do. I got on my soapbox and put a few tips of my own, really from my own experience, into the Ellison guide to resilience, I might have called it, or resilience 101 perhaps. Really, it's about monitoring your response to stressors around you, because we really shouldn't worry about things that we can't control, because what's the point in that? Things are going to happen anyway. Where that all falls down, I think, is when we worry about loved ones' health. We can't control that. We can't control their behavior, but we still worry. When we worry about other things, like bigger world things like climate change, for example, getting a lot of climate change anxiety. And that's really interesting because we're seeing that happen a lot in adolescents and in teenagers who find it hard to contextualize their worries. And the reason why that is because their frontal lobes aren't developed yet. They can do so many things at the age of 18, but they're not fully grown yet. So this frontal part of their heads, their frontal lobe, it's the part of the brain that is doing decision making, the part of the brain that's doing planning, consequences, thinking about consequences of actions, and that's not fully developed until you're 23. But you've got these 18 to 23-year-olds running around. They can do all sorts of things that other grown-ups can do, and so they tend to find it harder to contextualize their worries. So it's about knowing that actually this too shall pass, but taking your own power back and saying, right, what can I do about this situation that's really, really worrying me? What can I do as an individual? And trying to take it step by step. And knowing that regrets are futile. You do what you do at the time with the best information that you have, and trying to say, well, look, let's just take the lesson and move on. Those kinds of things.
Now, I'd heard this term before reading your book, but I was pretty unfamiliar with what exactly they were. So for people who are in my category, what are cluster headaches?
Okay, so cluster headaches are those who suffer from migraine and have never experienced a cluster headache will think that theirs is the worst in the world, but actually cluster headache is the worst.
Wow.
And this has been tested objectively by various individuals across the globe. Yeah, cluster headache's awful. So it's something that will attack you and will often come on with the change of the seasons. So there's that's kind of a clue as to what its underlying causes, but it really is something where it can hit you really, really quickly. It feels so painful that oftentimes people who experience it will actually bang their own heads off a wall, because that is preferable to the pain that they are experiencing inside of their heads. It's really, really all pervasive. There is a treatment now, and it's a triptan, so it actually plays with the histamine balance and also the serotonin balance in your brain. And if taken quickly enough, that can stave off the cluster attack. But it happens very, very quickly. And it happens over a period of time. So it can reoccur, right? So it can go away as quickly as it can, but it can reoccur in clusters, hence the headache name. So it is actually recognized now as its own specialized headache, and it is recognized as being the worst headache that you can experience. It absolutely knocks you flat for days, sometimes weeks at a time. It's interesting because another motivation for writing this book is that the general practitioners, our doctors that we go to see, our non-specialist doctors, our family doctors, they don't tend to know the ins and outs of all the different types of headaches. And that in England, which is where I'm based, and certainly in Ireland where I grew up, it doesn't really hit the curriculum of medical school. Right? So in 75% of English medical schools, headache isn't even on the curriculum, right? Pain is just as bad. It's not really, doesn't really hit the curriculum. And from the research that I've done, I think the reason for that is because actually headache is seen as something that's solvable, right? You take a pill, you move on, you get on with your life, just get on with it, you know? But actually, you can do that over and over and over again. But are you really helping yourself by doing that? You're masking something that your body is trying to tell you. You know, maybe we should get to the bottom of this and stop that from happening. Stop whatever is causing your headache from happening. And then you won't have to take these painkillers or whatever it is that you do for your headaches. And you know, it's just really, really important to have that understanding of the different types of headaches. And oh, bless you. And the cluster and migraine headaches have always been coincident with each other. People wouldn't know the difference between those two things, but they are actually different, and their treatment would be different as well.
So as far as migraines go, I've heard of them. I thankfully, much like with cluster headaches, have not suffered from migraines, but I know people who have. And even though it technically comes in number 2 in terms of the least comfortable headaches, you can tell that it still sucks for the individual having to deal with that. How are migraines different from your standard run-of-the-mill headache?
Migraines are eminently fascinating. So what we've talked about up till now are headaches that are mainly vascular. Okay, so you get this widening of blood vessels, and that's where you feel the pain, right? And it can have knock-on effects and various other things, and particularly in cluster headache. But migraine's really interesting because something's actually happening in your brain that causes the vascular effects. And it's the vascular effects where the pain comes from, but all of those other symptoms that happen in migraine. So people experience flashing lights, they experience generalized weakness, they experience the inability to put 2 words together to form a coherent sentence, which is sometimes my life, but you know, it depends on what I'm teaching. So it can really, really be an event, and that's what I call it. I call it experiencing an event. It's not something that's happening inside of your head. It's something that's happening in your brain that is causing biobehavioral effects, you know? And the reason why it does that, and the reason why it knocks you flat, is because all of your neurochemicals, they're all in the wrong place, right? And all their concentrations are wrong and everything. And so the only thing that your body can do is actually just stop and reset itself. And it's, you know, it's analogous to how it is that sometimes we lose consciousness if we're in serious amounts of pain. It's our body's survival mechanism. It's our way of protecting ourselves. So migraine's pretty much the same. That's what it does. It knocks you flat in your back because you have a huge imbalance of these neurochemicals, and they're all in the wrong place because of what's happening in your brain. And you just go down with it. So there's 4 different stages in a migraine. And this is generally what people don't realize about migraines, that before you even experience the pain phase, you can have had 2 phases already, right? So you get the prodrome phase, which migraineurs, people who experience migraine, they're really, really bad at recognizing this, like tremendously bad. It's laughable how bad they are at recognizing when it is they're actually going to get a migraine episode. And the reason why they're bad is because actually these neurotransmitters and these neurochemicals and their hormones are imbalanced, right? They're not balanced at all. They're not in the right concentrations. And what that makes them then do is carry out various behaviors to try to rebalance them. So what am I talking about? Well, I'm talking about yawning, right? Because that plays around with your dopamine transmitters, right? And I'm talking about feeling a little bit more needy than usual. So they're a bit more huggy, you know? And that then plays around with your serotonin balance. So they're actually trying to self-medicate, really. You know, you might get a craving for chocolate. Well, chocolate is packed with tryptophan, which is broken down inside of your body into serotonin. So that helps you play with your balance. So that's led people to think that the chocolate actually triggers their headaches. It doesn't. You get the craving for chocolate, which you eat, And that is in an attempt to rebalance your hormones. Sometimes it doesn't work. You get the headache anyway. So people think, oh, I ate chocolate, that gave me a headache. But that's not true. It's actually the imbalance that's yanking your behavioral chain and saying, give me serotonin, eat chocolate, have a hug, you know, that kind of thing. And that's what's fascinating, that what's actually happening in your brain is having real demonstrable effects on your behavior, because you're actually subconsciously trying to self-medicate to rebalance these hormones so that you don't develop the headache, which is phenomenal. You know, I mean, that's just amazing. How many headaches have we headed off by just having a hug or having a laugh or having chocolate or yawning our heads off or whatever it might be that we might have done in that prodrome phase? But, you know, it doesn't always work. And then sometimes, you know, it does develop into a headache. The next stage that people might have recognized is the aura phase. That's when you see those flashy lights. Not everybody experiences that, but the same thing is happening in their brain as the people who do actually experience the flashing lights or the pins and needles or whatever they might experience as an aura. The difference is actually how eloquent their brain is and how much that actually comes to their consciousness. But the same thing is happening. It's pretty much like a little bit of a storm that's going on inside of the brain. It's a wave of excitation that goes from the back to the front, towards the front of the brain. And that wave of excitation, all your nerve cells are active, right? And then it's followed by a wave of depression, because all of the ions, all the little charged particles that cause that electrical activity in your brain, they're all in the wrong place. And your brain can't do anything anymore because, you know, nothing's in the right place. So it actually has a wave of depression in that it just stops working. So you get this wave of excitation that activates everything, and then a wave of depression where nothing is active, right? And then this sets up interactions between those brain areas and other areas that cause the nausea and all of that rubbish that you get when you're going through a migraine attack. But you also get, because one of your ions is called potassium. We all know that bananas are full of it. It's really important that all of that potassium is generally inside of your neurons, but it all gets trapped on the outside of your neurons. And that's a really bad place to have it, because it means you can't have electrical activity anymore. God. And also it acts directly on the pain receptors on your blood vessels. And it causes vasoconstriction, right? So instead of widening, they get really, really narrow. And that means that you can't flush away all of this stuff that shouldn't be outside of your neurons. And you don't get as much oxygen to the brain regions as you should have. You don't get the nutrients. And of course, your brain goes, oh, hang on, this isn't right. Overdose on the old vasodilation. So you get rebound vasodilation. Your blood vessels are wide as wide can be. Your pain receptors go, oh no, this is terrible. Throb, 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 throb. And that's where the pain phase of the migraine comes from. The whole thing is exhausting. That can last, you know, for hours and hours. Usually people just take themselves off to bed in a darkened room because they have this huge amount of photophobia and you know, they don't want any noise around them or anything because their brain is so sensitive now. And then you just get this kind of exhaustion and fogginess that comes afterwards. Some people experience euphoria in that phase. So there are some accountants that I spoke to about their experience with headache. I was trying to fractionate out eye strain and looking at lots of numbers and deadlines and things from the actual migraine attack that they might experience. And one particular woman pulled me aside at the end and she said, I don't talk about this with my friends, but after I've had a migraine attack, I feel like I've had an orgasm. And I said, I'm sorry? And she said, yeah, she said, and actually it's perfectly reasonable because as your neurotransmitters are rebalancing, you can go too far on serotonin or the dopamine, and you can feel that euphoria. but she said she never told her friends because she felt guilty about that they didn't experience this at the end of their migraine, but she did. Usually you just have this mental fogginess, and you have to pay attention to that. You've got to let your body reset itself. You can't just get on with it.
A lot of people don't realize that dopamine not only is partially responsible for our pursuit of pleasure, but also pain as well. So I guess it makes sense that coming back the other direction, that it can lead to such ecstasy. Now, why does menstruation lead to migraines sometimes?
Okay, so menstruation is all about the fluctuating hormones, because what happens in the menstrual cycle is that you get an increase and a decrease of estrogen and progesterone. So it's up and down, and that's just as part of the menstrual cycle all the way to menopause. Whereas the male tends to release hormones pretty much just at a level, right? Whereas the female brain releases hormones cyclically. Okay, so it's this up and down. Now we know that estrogen is not only vasoactive, so it has an effect on how wide our blood vessels are, but it's also psychoactive. So it plays with actually the dominance of our hemispheres, so our left and our right hemispheres. So we know that it's having an effect on our behavior, but we also know in our brain, and that translates actually to behaviors in real life. So it does unfortunately mean that women find it very, very hard to parallel park, but only for about 20 minutes every month. So there's no point in generalizing this, okay, right? Yes, women are worse at parallel parking, but for 20 minutes every month, that's it, right? So we can't generalize it. So it has real behavioral effects. And that's a really interesting thing, but that's probably in the story. So we know that it's acting on the activity of our brain, which we know migraine is all about, but we also know that it plays with our blood vessels as well, which migraine is about as well. So between both of those, we know that people who are in high estrogen phases of their menstrual cycle, they tend to experience migraines with aura, whereas those who experience migraines in low estrogen phases, they tend to experience migraine without aura. Now, that then means that given that we know the same things happening in the brain no matter what, it means that it may be the estrogen that's playing with the eloquence of the cortex as to whether or not it actually reaches our consciousness, which is really, really interesting, but again, yet to be proved. So we know that this fluctuation of estrogen has an effect, and that is why the correlation of more women suffering from migraine is true. So we also know that if we were to go by correlation, that you're more likely to suffer from a migraine if you're under 5'3" and you're a redhead with a luxuriant head of hair. And if you have an inverted nipple, then you're triply cursed as well, because then you're more likely to suffer from a migraine. This is back in the day when a lot of science was done by correlation and not causation.
Wow.
But we know that observation that more women suffer from migraine than men do, that is actually causative. That is due to this fluctuation in hormones, the menstrual cycle. How do we deal with that? Well, we can artificially affect the concentration of estrogen by taking the contraceptive pill. And that is exogenous hormones, where you set the level at an abnormally high level, but at least you don't get that fluctuation. You may have migraine to begin with that, but it should actually dissipate over time, and it should control migraine that way. Not helpful if you're trying to start a family, of course, or have a baby, because you need that fluctuation of hormones in order to create the conditions in order to reproduce. So that's not always a good plan. The other plan is to wait for menopause, when things become less cyclical and the incidence of migraine in women does decrease.
Generally speaking, has science gotten a beat on how to treat and hopefully eventually cure migraines?
Yeah, it has. It really has. Things have come on a little bit in the past 10 to 15 years. And this is what's really, really interesting, actually, about writing a book like this, right? Because you get to put all of the bits of evidence together, because people generally tend not to do this. And in my world, you're either a biochemist, or you're, a molecular neurophysiologist, or you're something else, and you don't meet people in the other streams. You might all be looking at the same thing, but you don't meet people who are looking at the same thing from different angles. And that's why it's such a joy for somebody like me who never got past the why phase to actually be able to put those things together and say, oh, here's the answer. Here's what we can do. Now, there are some things that we can do chemically. So there's some treatments that have come along and actually have been regulated really, really recently.
Beyond eating a lot of chocolate.
Yeah, beyond eating a lot of chocolate. But there are things that actually play with the serotonin balance. We've talked about triptans. So they play with the serotonin balance in your brain. But also there's another one that plays with a particular protein called calcitonin gene-related protein, which there seems to be a heck of a lot of in the brain of people who suffer from migraine. And so this is a blocker. This drug would block that. And that can be taken as a preventative for migraine. So that's an up-and-coming new kid on the block. But actually being able to look at all the other biobehavioral things that we might do to stave off our headaches, to look at the validity of the triggers that people think are out there that start off their headaches, and say, you know what, is that a trigger, or is that something that we do to try to stave off the headache, like we talked about with chocolate? It's about actually regulating our control over our own headaches. And, our happiness is part of that as well, because again, you think about happiness, you think about serotonin, you think about that as being a natural painkiller, but also as being very important in hormonal balance that people who suffer from migraine are incredibly sensitive to. Two other things. One is that a very understated and unknown trigger for migraine is actually vertical blinds, or horizontal blinds, or any lines of any description. So like Indian rugs with lines of different orientations. And that will drive a migrainer nuts, right? So if it's a weapon, honest to goodness, this is a weapon. It's a torture device. It really, really is. So, and the problem is we are surrounded by lines in Western cultures. We really are. And there was a fashion out a couple of years ago with like lots of really stripy tops and things like that. And I can sit in a meeting with lots and lots of men who are wearing shirts with lines of they're either vertical or the horizontal, and they'll drive me nuts. Like, really, I cannot look at people. I have loved lockdown because I can just turn off their camera on Zoom, right? And I don't have to see them. It's wonderful. My migraine instance hit the floor. Why is that? That is because when you're a migrainer, your visual cortex, the area at the back of your brain that is very sensitive to light. So it's the bit where you actually turn light into signals that allow us to understand the world in terms of what it is that we can see. It's our visual areas. As a migrainer, it's incredibly sensitive, really sensitive. And of course, we know that migraine is started by an overactivity in a part of the brain towards the back of the brain, usually the visual cortex. Well, of course, if you're particularly sensitive to lines, you walk into a room with lots and lots of blinds or lines or people with stripy shirts, and it's awful. That can actually trigger off a migraine attack. So knowing that helps you to steer clear of that kind of thing. And then
somebody who's suffering from migraines would have a real problem in like a 1940s prison where all the
oh my goodness, absolutely, yes. And you see, people don't realize that this is a trigger. Now, triggers don't tend to happen in isolation. We've got a threshold, and over that, you're on a pathway to migraine. But under that, there are things that you can control, and it may just be that knocks you over the edge, that kind of thing. But another thing that was really interesting that I discovered was that people who suffer from migraines have a much bigger concentration of bacteria in their mouths that break nitrates down into nitrites, right? Why is that important? Well, Nitric oxide is really important in your body as a vasodilator. It really helps when your muscles are in cramp with bad posture. It's released to cause vasodilation, bring more blood to the area. Your muscles are in cramp because they're working anaerobically. They don't have enough oxygen. So you want to bring more blood to that area. It's that vasodilation that then we detect as stress. Okay. And everything, it's a vicious circle. So we need it. We really do need it. But too much of it, well, that's going to cause a problem, right? Now, anybody who suffers from angina will probably have been given a glycerol trinitrate spray, GTN. You spray it under your tongue, and it is a nitrate that is then broken down by the bacteria in your mouth into nitric oxide, right? Causes vasodilation in the blood vessels around the heart. And that then relieves the angina attack. But it can also cause vasodilation in your brain, which is why some people get headaches out of use of the GTN spray. But it can also trigger migraines, but so can eating nitrates. Now, nitrates are in bacon, they're in any kind of cured meats, they're in some leafy vegetables to a degree, but definitely in meats that have been very preserved. It's a powerful preservative and antibiotic. So that's why we use a lot of it in salted and cured meats and fish. So if you start your day with the bacon sandwich and you've got many more of these bacteria that break the nitrates into nitrites, that means you're actually overdosing on the nitrites, as opposed to your counterpart who may not have as many bacteria that bust them into nitrites. So what do you do about that? Well, just swigging your mouth out with some mouthwash before you eat your bacon sandwich would work, or don't eat the bacon sandwich, So sometimes there's things that you can break it all down and say, right, okay, there are things behaviorally that I can do. Let's try those before I go down the drug route.
That's interesting about bacteria in the mouth. That makes me wonder just how in play the gut microbiome is with something like migraines.
Absolutely, yeah. And it has a huge effect. And we know this both anecdotally, but also phenomenologically and also scientifically. We're only really just scratching the surface. Really, we're only scratching the surface. And the one thing that we keep forgetting is that when we talk about hormones, we think about, the big players. So we think about an area called the hypothalamus, that's hormone central in your body. I love it. It's a brilliant area of the brain. I'm not too proud to admit that it's my favorite part of the brain. There's that. But then you have all of the different glands that it acts on, things like your thyroid gland, you've got kidneys, you've got your pancreas, all of these things. But what we always forget about is that our stomach and our gut are huge producers of various hormones that again are vasoactive and psychoactive as well. And we just don't give them the credence that they allow. And this is what's fascinating about physiology and about how it affects our brain and our behavior and how linked it is, and how we can't actually think about one aspect of it without thinking about all of it. And we're certainly not going to be able to help people by looking at it from just one angle. We've got to look at all of it.
You accurately and humorously point out that we as humans are walking bags of water, 60% water for that matter. Just how big a deal is dehydration with a lot of headaches?
Huge deal, absolutely huge deal. I had a dehydration headache myself today, and I should know better, right? So it is a big deal. And the reason why it's a big deal is because it's not just something that happens instantly. Okay, so it's not like you don't have a glass of water and all of a sudden you have a dehydration headache. It's actually indicative of behaviors that may have lasted days. So you've been doing things that actually maybe you've been doing because you wanted to reduce your stress, right? So what do we do when we're stressed? Well, we say, oh, I know what I'll do. I'll have a takeaway. I'll have some takeout food. I'll have maybe a glass or 10 of wine. I'll have a few beers, that kind of thing. And actually what's happening there is we're actually carrying out behaviors that we think are going to help our stress, but actually are going to give us a headache. So it's often coincidence with stress headache because it's a behavior that we often carry out to reduce stress, but end up with a headache anyway. So What's going on? Well, we need water to excrete all of these chemicals and food that we eat and everything. It all gets broken down in our body, and we need to excrete it. And we need to excrete it safely. So we need to dilute it. So our kidneys need to take water, and needs to take water from our body in order to dilute these nasty, noxious chemicals that are floating around in our bodies. It's worse if we've imbibed alcohol, because we definitely need to dilute that before we can excrete that. It's ethanol safely. So, and it takes a lot more water to do that. So if we haven't been drinking things that actually will replenish water, and coffee's not a good thing to do here, because coffee is actually a diuretic that will make us wee out the water instead of using it sensibly in order to dilute these chemicals or ethanol or whatever else might be floating around. So our body needs to take the water from somewhere, and if we're not drinking as much water as we are excreting, then we get dehydrated. So what does that mean? Well, it means that actually we're taking water from our blood. We're taking water from our mucus. We started off talking about mucus, and if we're a little bit dehydrated, that mucus becomes more slurpy. It becomes more gloopy. It doesn't become as it's not as runny as it usually is. So again, when we're suffering a sinus episode, we need to make sure to stay very well hydrated, because it'll be more comfortable. Our mucus will be more comfortable in the end. But the place in our bodies that actually is a repository of water is our brain. It's made mostly of water, really. And so our kidneys take the water from there. Once it's taken water from everywhere else that it takes it from there. And you can actually lose 20% of the volume of your brain this way. Okay. And that means it shrinks. It's like an oasis that you stick flowers into, it shrinks as it loses its water, and it pulls on the membranous coverings of the brain. It's called the meninges. And that causes pain, because you've got pain receptors embedded in the meninges. Funnily enough, you don't have any pain receptors in your brain itself. You can poke around in a brain, no problem. Nobody would feel anything, which is why many brain surgeries are done while the patient is awake, because they don't feel surgeons poking around in there. But it's important to know whether you're touching anything that would affect speech or would affect movement. It helps surgeons to stay away from important areas. So yeah, that's how the dehydration headache works. And it does just feel like the inside of your face and the inside of your head is just pulling, doesn't it? That dehydration headache that we get. And again, because of that, then we get a stress response that's mounted to that, and everything that happens at the same time. And if you're hungover, that's pretty much the basis of the hangover headache. But you can also get anxiety, which it's a term that was coined by David Nutt. And it really is around the fact that alcohol it's a phenomenal substance in how it affects your brain. It relaxes you, not just by increasing the inhibitory action of certain neurochemicals, but it also decreases the activity of excitatory neurochemicals. So it's a double whammy right there. And, as you're sleeping it off, you might wake up in the middle of the night, usually because you need to wee, because you're trying to excrete the ethanol from your body, but also because you've got the makings of this dehydration headache. But once you do, you might feel incredibly negative. I call it when the wine starts talking back. And you feel very, very negative, because it's like the dial has spun, the pendulum has swung. So instead of being in a very almost relaxed, inhibited state, you get a little bit more excited than you ordinarily would. So the pendulum swings the other way, and you feel quite anxious, but you still have that negativity side to it all. So you feel anxiously negative, and it's called anxiety. And it's when the wine starts talking back.
What a vicious
It passes,
cycle.
but not necessarily quickly.
What a vicious cycle that is. To
Yeah.
our last question, Amanda, As far as the future of this field of study is concerned, what is an important question that you are currently racking your brain to try and figure out?
That's a really, really good question. There's lots of questions that I try to rack my brains, or that rack my brains for me. I think that the main thing is to try to understand things not in snapshots as we currently do, right? So we often say, okay, so this is great medication, take that for the rest of your life. But what we forget about is that people's lives change, their environments change, their stressors change, the thing that what they do changes, and that can all feed back to how it is their brain and their body are working together as well. And so that can then change how effective medication is, or they may be over medicating. That concerns me. That's a real concern, that we don't take that kind of biopsychosocial drift that we all experience as we go through life into account, and how it is that we treat not just headache, but lots and lots of other medical ailments. So yeah, that preoccupies me a little bit. But really, it's just about, mainly it's about trying to break things down so that we can make it to the point where we understand various aspects of it, and so that we're not just helping some of the people some of the time, but we can actually help all of the people all of the time by going at it through an individual and personalized experiential point of view, as opposed to just taking a condition and saying, what can we do to fix that? It's different for everybody. We've got to understand that so that we can help everybody through it.
The personalization of medicine is, I think, going to be a huge, huge factor going forward. And I'm very thankful that you, amongst others, are on the right path in that regard, and you're working hard to help out in that regard as well. She is Amanda
Mhm.
Ellison, a psychologist and neuroscientist at Durham University. Her book, Splitting the Inside Story on Headaches, is out now in paperback. Amanda, thank you so much for the time today, and thank you for this informative and very funny book.
Thanks so much, Trey.